Okay, it is now time for the wellness report. Weight loss shots have become very popular amongst Americans looking to burn off unwelcome fat. These injections, GLP-1s, work by suppressing your appetite and eliminating what is commonly referred to as food noise. And though many people call it a magic bullet, there are side effects that come along with their use.
Among the most recent, more than 100 reported deaths in the United Kingdom relating to the use of these drugs. At least 10 of these deaths are linked to pancreatic issues. The report does acknowledge, however, that it's not totally crystal clear if these deaths were directly caused by the jabs.
These are things like Ozempic, okay? Meanwhile, there is a report about some users suffering from auto-brewery syndrome, where the body actually produces alcohol inside of itself as a result of an imbalance in your bacteria in your gut. It's a disease that literally leads you to feel drunk despite not having consumed any alcohol. Okay, maybe not such a bad idea. It's a joke, Christina there. All right, let's get the expert analysis from former co-director of Children's National Obesity Programs and director of the Child and Adolescent Weight Loss Surgery Program for Children's National Hospital, Dr. Evan Nadler. Doc, good to see you. Thanks for coming on today.
Yeah, thanks for having me, Bob and Christina. And I'm glad you made that joke before I did, because I was going to make the same one.
It was low-hanging fruit. So I feel like
especially on the 4th of July, right?
Exactly.
I mean, everybody's going to,
Gotta keep it lighthearted.
Yeah, okay. Talk about the risks involved with these. I've always, to me personally, thought it was odd shooting yourself up with this stuff, then all of a sudden you become skinny. It just kind of seems off to me. Your thoughts on all this?
So the GLP-1 drugs are actually a great scientific breakthrough. They've come up with mechanisms that not only control your weight, but they're used for diabetes. They're used for they can prevent Alzheimer's, renal disease, heart disease. So I don't want people to think that these medications are bad. Do they have side effects? Sure. Every medicine has side effects. If any of you are on statins for your cholesterol, those have side effects. So, I think it's important that everyone is informed about what can happen. And I think it's important that if you're going to take one of these medications, you're doing it under medical supervision as opposed to getting it from an online company, and also getting the name brand medications as opposed to ones that are made by pharmacies that aren't FDA regulated. But on the whole, these medications are doing a lot more good than harm.
So you hit on something that I wanted to bring up, because there's been so much praise surrounding these GLP-1 medications. Some saying they're a miracle, that when people take them, they no longer feel other addictions that they might have. They're helping people who have alcohol, drug, shopping addictions even. It's inhibiting some portion of the brain, I guess, that stops you from feeling the need to, eat so much food or maybe take that drug or use that alcohol. But the problem comes in when people who maybe don't need to be taking them start going through these other websites, trying to get them when they probably shouldn't be on them. And now we're seeing these deaths come out of the UK. Do you think there's a correlation there that maybe it's dangerous if it's not something that you should be prescribed?
Well, I think certainly it's hard to know whether these complications in the UK were from name brand drug or other. I 100% agree that the problem lies in when people who don't need it, don't need the weight loss for their obesity or for diabetes, are using the medications to quote unquote look better, although there is some value to feeling better about yourself. But just like any other medication, if it's not used in a proper manner, it can definitely lead to problems. And again, hard to know whether these cases that are being reported are related to misuse or just general use, since the package insert actually on the GLP-1s, on semaglutide, for instance, does mention pancreatitis. So people know that can be a problem. It's just whether or not there are doctors who are informing their patients of this potential problem.
Real quick, Doc, 20 seconds here. Is it easier or more safe for younger people to take these kinds of drugs than older people? Is there any kind of difference there?
That's a great question. And I think safety, hard to know, but I think it's more effective in younger patients in that they can change their lifestyle. They can more easily do what they need to do, maybe, than a 40 or 50-year-old who has the same problems. but only one of them currently is approved for children down to age 12. But I actually think that's where the market may be heading sooner rather than later.
Wow. We'll have to wait and see. Interesting. It's a fascinating drug to talk about.
Certainly is. And Doc, one thing you picked up on that we got to run, lifestyle. Losing weight is tough, and sometimes you got to change your lifestyle just to do it. Dr. Evan Nadler, good to see you, sir.
Thank you, guys. Happy to come back anytime.
Thank you. We appreciate it.